Okay, so now we're going to move on to Teresa, and she's going to help us see how the right insurance plan is going to help us meet all these wonderful goals. So, Teresa, I can only imagine how challenging it is to keep up with the complicated, ever changing world of medical insurance and specifically Medicare. So, is it possible for you to sum up in just a few sentences the most critical recent changes to health insurance?
I've been in space for quite a few years, and this year I've really never seen such a big change in Medicare. So, outside of any company, Medicare made a lot of changes starting in January. Have you guys ever heard of the donut hole or coverage gap? It's been around for years. Well, next year it's gone. Um, they passed a law, it's called the Inflation Reduction Act, and there's lots of things in this law, but part of it is highly influencing Medicare. So next year, there's no more donut hole. It's a max of $2,000. If you have generic drugs or extra help with prescription drugs through Social Security, you won't be affected. But if anybody has any brand drugs, you need to check your insurance. So what's going to happen is you go to the pharmacy in January, and let's just pretend your prescriptions are $500. Well, you can opt into a payment plan. Medicare forced the companies to offer a payment plan to all customers, and you can spread your costs over 12 months. So $2,000 divided by 12 is $167. That's the most you could pay in a month. Now that's if you have, Mounjaro, Eliquis, Trulicity, all these drugs that cost $2,000, $600. They're a lot of money. I have a guy right now is on Mounjaro for diabetes, and he pays $550 a month just for that drug. So he is ecstatic. He cannot wait till January comes around. So what's going to happen is when you go to the pharmacy, you're going to say, I want to opt in to this payment plan. They also are sending you literature right now, the companies are, to opt into this payment plan before January 1st. So you're going to take your prescriptions from the pharmacy and not pay anything, okay? Bill you for your prescriptions. Blue Cross or Priority Health or Humana is going to bill you for your prescriptions. If after 60 days you don't pay the payment plan, you'll get kicked off the payment plan, because I can see a lot of seniors getting a bill and they're like, I didn't go to the doctor. I'm not going to pay this bill. I don't know what this is for. So after 60 days, you get kicked off the payment plan, not the insurance. And then when you go back to the pharmacy in April, you could owe the full $2,000. Now, what this did to the carriers is that if someone decides, in April, I can't afford $2,000, I'm just not going to get my drugs, well, the pharmacy won't get paid for all those months of prescriptions. The carrier will not get paid for all those months of prescriptions. So they don't know what this extra cost is going to really cost them next year. So that's why all your plans kind of cut back on the extra stuff, the over-the-counter allowance, some of the extra stuff, because they don't know what debt they're going to go into. The other big thing that this did, it got rid of the extra enrollment periods. So some people can enroll once a quarter throughout the year. Some people can just do it from January to March. Well, now unless you have a life change, you can only enroll, make a change. You enroll right now, but you can make one change from January to March. If you answer one of those call centers and you say yes to any question, that was your one time. I can't fix it anymore. In the past, I've been able to fix those, if that call center puts them on a plan and they don't look your prescriptions and doctors up. So I get at least 10 to 15 calls a month. I went to the doctor, I went to the pharmacy, I can't get my prescriptions. I'm like, oh, who did you talk to on the phone? So just try to hang up. We're not used to being rude, but we just got to be rude with those things. The last thing it did is it allowed Medicare to negotiate with our drug companies. Medicare has actually never been able to negotiate with drug companies. Isn't that crazy? But with this new law, they can. So there's 10 drugs that they're going to come out first with, the most popular 10 brand drugs, Eliquis, Jardiance, there's 10 of them. So they negotiated the price down, so probably the tier level of those drugs will come down and ultimately cost less for Medicare. The last thing it did do is above $2,000, Medicare pays 20% instead of 60%. And then that extra cost went on to the carriers and the drug companies. I know this is a lot of information, but really what Medicare is trying to do slowly, these are baby steps. Hopefully there's a lot more to come, but they're trying to prolong Medicare. And they're trying to reduce the Medicare costs and make some reforms. So that was a lot of information. The one last thing, sorry, is if you know somebody working over 65 at an employer insurance, that employer insurance now has to abide by this $2,000 law, $2,000 rule for their employees that are over 65. If they don't, then it's not considered credible insurance anymore. So they need to go to their HR department now and say, hey, is my insurance credible? What I found so far is most of them didn't have time to make the changes for this year. For 2025, I'm sure most of them will be fine in 26. But if your insurance is not credible through your employer and you keep working, you'll start to incur late enrollment penalties in January. So if you know somebody that's working past 65, make sure they go to their HR department and get some kind of letter proving it's credible insurance. A lot changes.
There are a lot of changes. So along those same lines, so are there any specific important deadlines that everyone in the audience should be aware of right now?
Yes, so the key is if you have a Medicare Advantage or standalone drug plan, please have somebody look at it. Most carriers, most plans, there's like in Kent County, there's 110 plans in 12 or 14 carriers. I cover them all, but you need to put your prescriptions in and see which plan is best. A lot of the plans went to a % for tier. So this year, a brand drug is $47, $42 a month, whatever. Next year, most plans went to a % for all drugs. So like I helped a customer last week, they have Eliquis. Just by switching to a different priority health plan, they're gonna save $1,000 for the whole year because it's a copay for that Eliquis instead of a %. So by December 7th, that's your deadline to make changes for January 1st.
Great. So every year I receive this big, thick booklet entitled Medicare and You. I'm sure many of you do. And I really have good intentions. I'm very much an optimist, and I seriously think that I'm going to sit down and read it. Okay? And every year it goes back into the recycling again, never being opened or read.
Yeah.
Anybody else feel like that? So how do you recommend that seniors keep up with the most important aspects of their Medicare plan?
Have a person that understands it. Literally, I have to take weeks and weeks of training in the summer because every single carrier makes you take training. Medicare makes you take training, and then you have to understand all the changes that all these companies make with all their plans. And so, just have a person. Make sure everything in that book I have to basically understand and know. And what are the changes? What are the differences? How do I get to those resources? So, hey, here's your prescriptions and I put it all in, and based on county, it tells me the cost by even pharmacy. Which pharmacy is going to be cheapest for you. If you want to do mail order, how much that's going to cost. It does the whole thing for you, and it tells me which plan is best.
And I just feel like it's a good moment to just say, this is a prime example of how important it is to have a person. Now, this series and all the resources that have been in this room, when it comes to having a person for, not only healthcare and insurance, but regular insurance, your finances, your legal health and setup, your real estate, all those things and all the people that are in this room are designed so that when you have a question, you don't need to call a 1-800 number or Dr. Google. All right, it's so helpful to be able to have somebody that recognizes you and you recognize them and you can trust that they have your best interest in mind, even if it's not a sales opportunity. It's simply, we are here to be resources for you, which is so, so important. So health challenges often lead to other health challenges. So the goal of staying healthy should be top of mind for all of us. So what are some of the things that insurance companies are doing now to help people proactively stay healthy? And how can people tell if these things are already included in their plan?
That's a great question. So, of course, all the companies offer programs where you can go to the gym for free. Um, Priority Health went to One Pass, so you can go to the Y. A lot of the companies, on top of Silver Sneakers, offer MVP and some other gyms. So there's lots of opportunities. On top of that, they have online classes. Some of them will send you a home kit. If you can't get to the gym, they'll send you like the big ball so you can do your balance exercises or the stretchy band, different things so that you can do things at home. Almost all of them also have apps for memory, so if you want to play a game on your phone or whatever, but it's specific to help you with your memory and improving your memory. Um, all of them now have over-the-counter allowances. Some of them are monthly or quarterly, so you can get your vitamins, your toothpaste. Some of them allow that allowance to be spent on food. It really depends on the plan. And also depending on, let's say if you have Medicaid, you can use it for utilities. Those commercials you see on TV the papers you get and say, oh, you can buy utilities and food and over the counter, those are for folks that have Medicaid and Medicare that are low income. So they'll get your information and then tell you you're not qualified. Some of them have transportation when they're Medicare plans. So I have customers who need help getting to the doctor, they need to go to the grocery store. They also have personal emergency response systems, some of the companies, not all of them. But if you feel like you are home alone and if somehow you fell and you can't get up and you don't have anybody in the house, you have a button that you can push. There's also a care manager. So if you need something and you healthy wise, and I also do that as well, but if you need help in the home, Area on Aging is a great resource. There's so many nonprofits in our community to help with aging and healthy, making sure you stay in your home. So you just need, you need a person, but there's a whole bunch of things that help you with your health insurance. A lot of people have no idea.
Yep. It takes a village. And I encourage you once again, like the notebooks that we keep, all of these resources from all the people that come in month after month, just keep that, because so often I'll even think of someone like, oh wait, they were a speaker a year ago, I've got a resource for that, and just thumb back and you'll be able to hopefully figure out who that is. So let's talk for a moment about how being married or single might affect a person's choice of medical plan. So is there any benefit for married couples to be on the same plan, or is it much wiser for each person to choose a plan based on their individual health needs, regardless of whether they're married or single?
Great question. There's two types of Medicare plans. There's an Medicare Advantage plan and a Medigap or Medicare Supplement plan. With a Medicare Supplement plan, it has a premium, and if you have two people in a household, you get a household discount. That's a Medigap Plan G, Plan F, Plan N. If you have a Medicare Advantage plan, there is no discount because your Medicare number is like your Social Security number. It's an individual number based on the person. However, is single, even if they're living in the same house with another person, their income is just based on their own income. If you're married, it's based on a couple. So some people that are single, if their income is lower, they would qualify for Medicaid, even if they're living in the same household. It's based on an individual income. So the only discounts as a married couple would be if you're on a Medigap plan, which is a Plan N, G, or F. It does have a household discount, but Medicare Advantage plans do not.
All right, so from an insurance standard provider standpoint, what's the best advice that you can give to seniors who are ready to proactively address staying healthy? And how do they find out more when they have questions?
There's some really fun plans out there that are trying to be proactive that give you money for golf fee or for a treadmill. Obviously, a lot of their co-pays may be a little higher because they're basically trying to be proactive and get you active so that you don't have medical issues. There's some plans that give you money back into your Social Security if you're paying for Medicare. It really depends on your needs individually. Even a married couple, one might be sicker than the other. One's really doesn't take any prescriptions. They could be on a plan where it gives them money back in their Social Security check, and the other one needs to be on a plan with a very low max out of pocket, low co-pays. So it really is an individual decision, but there's plans for every type of person. Really, you just need to have a person again and let them look at all the plans and figure out what's best for you. And every year it might change.
Teresa, thank you so much, because ultimately, you know, healthcare is designed to keep us healthy, and I also strongly believe in this idea that when you know you have a person and you know you have good healthcare, it not only but simply bringing down the stress of knowing that you're covered can go a long way as well, because certainly mental health is a huge aspect of keeping us healthy overall. So